For complete study materials and other assistance, contact Nursing Mantra through WhatsApp on 9715025155717. Question number 1. A patient was on a course of lithium carbonate drug. The nurse found that he complained from nystagmus, visual hallucination, and oliguria. Which of the following drug-related complications best symptoms? A. Overdose. B. Mild toxicity. C. Severe toxicity. D. Moderate toxicity. The answer is C. Severe toxicity. Question number 2. 49-year-old woman presented to the emergency department complaint of severe chest pain. The ECG showed that the patient myocardial infarction. The doctor ordered the nurse to give the 800 milligrams of aspirin. What is the primary indication of aspirin in this case? A. Breaks numbers. B. Decreases the formation of platelet plugs. C. Inhibits the conversion of prothrombin to. D. Interferes with vitamin K to maintain. The answer is B. Decreases the formation of platelet plugs. Question number 3. A nurse is given health education to the parent how to reduce febrile avulsion in the child at home. Which of the following medication is the safest intervention? A. Analgesic. B. Antipyretic. C. Antibiotic. D. Antiemetic. Answer is B. Antipyretic.